Hello, everybody. Anyone else out there get the feeling that the director of this course is out to get me? Not only is it 1 hour after lunch and you're all feeling sleepy, but I'm placed after all these great speakers who are amazing, and I've been asked to talk about the screw-ups, all the crap that you guys don't have to do because I've already done it first. So take a deep breath, wake up, wiggle it out. You can't be just sitting there. Nobody's wiggling. Why is nobody wiggling? If nobody wiggles, I'm not going to talk. Put your arms up. There you go. All right, now we can get started. Phew, I thought you were all asleep. I brought my own little thing. I see if I don't think that's working. I don't think you can see my little thing here. Well, I was going to try and show you something, but let's go through a couple of quizzes here. I invented something to help train people called Scalp. You'll play with it tomorrow if you're coming. So we're going to talk about top SMP complications. The number one complication is a patient with inappropriate expectations. And you think I'm kidding, but I'm really not. This is going to be quiz format. If anyone knows me, I like to quiz people. I like to write test questions. Okay, so what's wrong with this picture? It's interactive. You can just shout it out. What's on this side versus this side? Which side do you like better, the right or the left? Let's take a poll. Who likes the right side better? This side? Who likes this side better than this side? Yeah, well, if Jennifer Krejci's in the office, is Jennifer here? The reason is this is right after the SMP conference that we did after last year. The needle was just too big. The depth was set too deep. She was pushing too hard. This is the example of a learning experience. And she did it right. She sent this to me right after she got on the plane. So the pigment spread. This is an example of dots kind of just right. And you can see with this one, hopefully you can see my little, this one has the 1, 2, 3. This one was a 3 needle. What you're trying to do, see this? This is where the hair is coming into the scalp. See that little shadow of the pore? That's what you're trying to mimic. You're not trying to draw little hairs and match the color of the hair. What you're trying to mimic is the optical illusion of a hair going into the scalp. That's why gray-based pigments are so good for this. You're not trying to imitate the perfect red hair. If you are, you're doing it poorly. What's the wrong thing here? These are all mine. This is why I give a talk on how to remove SMP pigment, is because I learned. So the dots are too big. The solution is try a smaller needle first. It's a hell of a lot easier to remove something that's smaller that you haven't really done a lot of damage with. Set the needle to a shorter depth. Everyone up here has said 0.5 millimeters to start. And more dilute pigment might work. This is another one. Dots too big is not to be confused with migration of pigment and scars. Scars are tough. Everyone's like, I'd like to start doing SMP so I can help with my scars. Scars are the worst thing to start with. Start with someplace else because this is not normal tissue. This is a failed SMP. All right, that one wasn't mine. This is another one. What do you think is wrong here? You've got a patch that doesn't look quite as full. This one kind of looks as full. This is dots too visible, also known as hair bald scalp mismatch. The reasons are poor patient selection. Like this patient, if they wanted SMP, I'm not sure it's going to work out. You might be able to help them out, but you got to be really careful. This would be a better candidate for, put some hair. I don't usually do crowns, but usually, add a little bit more hair. It's going to look a little bit better. And if you've got somebody who already has bald scalp mismatch, you're going to have to remove it. Okay, what's this? Can you see this here? Close with mismatch, yeah, because it's really fine hair, right? So we start out with a really fine needle. Everything was too small. I'll show you here in a second. The needle was too shallow. The pigment was too dilute. It's better to do that first. This is when we corrected it. Can you see in here? A little bit more. This is when it's corrected. I'm going to go quickly because we've got 2 minutes and 32 seconds. All right, so this is a close-up of this guy here. I've got a whole bunch more. This is the same one you saw before. Here's another one. I think somebody else has used this one. This is the dots are just inconsistent, heavy, inconsistent pressure, probably a matter of inexperience, lack of practice, changing scalp conditions. You'll be going through something and all of a sudden your pigment will spread or the skin gets thin. Sorry, you got to remove it all and go back to square one. The nice thing is it's pretty easy to remove. What's the problem here? I'll tell you a secret. She's a postmenopausal woman, and there really isn't a problem. What she wants is more pigment. This is her before, this is her after. Really nice result, right? She comes back, she wants more. She wants to never see her scalp again. I did a little dot. See, that's where all the dots are. There's no way you can add more in here. There's no way you can please this patient. You have to talk them out of it. You have to say, no, that's it. So when your dots are too dense, it's usually your patient it's the tail wagging the dog thing again. It's too much, treatment is too early, the hair hasn't grown in yet, you've done too much. This is usually inexperience, and you gotta grow a backbone, unfortunately. This is another one. I took this and I kind of blew it up so you can kind of see the magnified view here. The dots are too far apart. So that's another, you're scared, put a little dot, just see how it goes. Or you've done a treatment too early before the hair has grown in. Here's another one. This one's a little tougher to see, but this lady came back. If you look closely, you can kind of see some discoloration of the scalp. And the pigment has faded faster than expected. One of the things on the solution side that I forgot to say is in certain patients, doing the cleaning your canvas thing that the previous speakers were talking about really helps quite a bit. And if you're using a small needle with too dilute pigment, this is a better problem than big blotchy black, because that you got to get out your laser and take it off. This you can usually work with. Here's another one. Here's another one. What is this problem? I even have another one. This is where the pigment is. And this is when he raises, see how he's raised his brow right there? So this is unnatural. Look at this one. Woo! This one's actually tattooing, even worse. Hairline is too straight, it's unnatural, insufficient training. Somebody goes to a tattoo artist, the patient's like, I want my hairline right here. And you're like, but maybe you weren't there that day and your SMP practitioner put it a little too low. All right, here's two more and then I'll get out of the way. This is when pigment is spreading during treatment. Look at that. I'm giving you the answer right off. Oily skin, change in skin thickness, maybe you didn't prepare your canvas. Stop the SMP immediately when you see that. You can use saline to get rid of it. See this? This is what happened. We noticed an immediate change. These dots are way too big, but ignore that for a second. A little bit after saline. Here's another, same thing. We had to come back later and take these two off with some laser, but after we corrected it, way better. This one spread after application, and this is when I lasered it off. There was only one spot left. It took 2 treatments to get rid of. Here's another one where it changes color. See that blue tinge? You can remove that, and I would remove it with a little bit of laser. It will not damage the hair if you do it right. And then the last one, this is scalp tattooing. Don't let your patients get bad ink. Talk them out of it. This is the blue that we're talking about. This patient and the previous patient, they're brothers. They went to the same exact tattoo artist. He's like, oh, I got this, no problem. Scalp micropigmentation, I got all the stuff. So he wanted this gone. He was willing to do anything. I said, if we take this off, the rest of your hair is going to be taken off too. He said, I'd rather have that than a blue head. So that's a full head tattoo. I've got other pictures of full head tattoos, but this is just a lack of scalp-specific equipment or supplies. Saline exfoliation works. In that case, you just have to do laser tattoo removal. You can also get some problems with anaphylactic reactions. That's rare, but I wanted to put this in here. Many other methods for removing tattoos have been suggested, including tannic acid, lemon juice, garlic, and pigeon dung. Please don't be on here with your patient having pigeon dung on their head. And that's it. Thank you very much.